Well, welcome to your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. I'm Sam Lassant, and we're here, my friends, at the new Pediatric Rehabilitation Services. Joining me now is Catherine Avillion, who is the Director of Rehabilitation Services, and Ben Ivey, who is Manager. First of all, beautiful place.
It is.
I wish you only the best here. It's really nice. So Ben, let me start with you, okay? Tell me about your position and what you do.
Sure. So I'm the manager here. I'm also a speech-language therapist. So I manage the team, help develop this center and kind of the procedures and policies that go into it. So manage the day-to-day operation, but then I also get to work with patients here for part of my time.
Catherine, being the director, okay,
Yes.
Tell me about you, a little bit about yourself.
So I have been with Lehigh Valley for 19 years. I'm an occupational therapist by trade.
Okay.
I am director of the Northwest region, so I have Schuylkill, Hazleton, and Carbon.
What would be some of the needs that you kids may need to get rehabilitation services?
So, I mean, specifically in the Hazleton area, there is a growing demand for specialized pediatric services. There's a strong neurodivergent population. We also have children with feeding issues and orthopedic problems. So there's a vast range of reasons why a pediatric patient would need services here.
And how would I know that as a parent? I mean,
well, typically your doctor, when you go to your doctor's visits with your children, there's milestones that your children should be achieving with each age or month that they grow. So if they start to see a deficit, or a parent's noticing that maybe my child doesn't play with other children like other children play, or my child maybe has trouble crawling or walking or performing a certain task, handwriting, they'd talk to their physician, and the physician may send them here for an evaluation by, so we have pediatric PT, OT, and speech therapists here.
tell me how they utilize this gym and why it's so important.
So the D'Angelos, they've always supported autism. That's one of the cornerstones of their philanthropic mission, is to support children with autism. Through the ABA centers, they have provided therapy for children across, from ages 2 to 6, across 16 centers in Pennsylvania and Maryland. They also founded the Collaborative Autism Movement, which works on sensory issues and sensory programs for children, and unified sports to include, that's all inclusive.
And how is this gym so important?
It's important because it fills a need. It fills a desperate need that Hazleton has for children. There's not a lot of services out there for children, especially the neurodivergent population. And being in Hazleton, it is vital that we provide these services close to home and provide access for our community. Early treatment is critical to success.
Here's what Krista had to say about the gym here.
Krista, why was it so important for your family to be involved in this and financially support it?
Our family gives a lot back to the community, and this is one of those causes that our family and our foundation do support. We were so excited to work with LVHN to make this a reality, and we couldn't be happier to support the project. It's amazing. I mean, the kids are going to love this space. I can imagine that they will not want to leave their appointments after this.
And we certainly would like to thank Krista D'Angelo and the whole D'Angelo family for all the good that they do. Ben, how does it feel to be in this location?
It's great. It's something we've been working towards for a long time. We started developing programs in this area years ago and kind of been working to this point. The location is central to a lot of our population, so it's easier access for our population, which is great. It was designed with every detail in mind to help these kids. You spoke about the gym. We went from really having not a lot of tools to use to having everything at our disposal here. So Lehigh Valley has done a great job to provide exactly what the kids need for this area.
And you put together a little tour for us, right?
We did, yes.
So let's show that video now.
Sometimes, children need specialized care as they grow. Lehigh Valley Riley Children's Hospital's Pediatric Rehabilitation Services are custom designed with children in mind. Our team of therapists and specialists improves the lives of newborns to 18-year-olds who need physical therapy, occupational therapy, and speech-language therapy. Located at 140 North Sherman Court in Hazleton, Pediatric Rehabilitation Services features a large treatment space that's about 3,000 square feet. In the space, we have separate areas specially designed for different types of therapy. These include 2 private consult rooms and 3 therapy session rooms. There's also a gym with a climbing wall and monkey bars for physical therapy, and even a separate room for sensory play. If your child needs rehabilitation services, talk to their pediatrician for a referral. We look forward to welcoming you and your family soon. Lehigh Valley Riley Children's Hospital, part of Jefferson Health.
Well put together, Ben. It was a nice little mini tour. Now, let me ask you, let's talk about your team here.
Sure. We have a growing team. With the opening of this center, we're adding 2 new team members, an occupational therapy assistant and a physical therapy assistant. We have some team members you'll meet later in the show, Georgette and Megan. Georgette is an OT, Megan is a PT. They've been here quite a few years, and then we have 3 other speech therapists that are part of our team as well.
Tell me what you've seen in the progress, particularly with Lehigh Valley Hospital coming in and doing what they're doing, which is raises bar every day.
It's just tremendous. It's tremendous what we've grown to over the past 19 years, specifically with this destination facility for pediatrics. I mean, every aspect of this center was designed with children in mind. And from this beautiful, colorful gym, inviting gym, to private treatment rooms, and areas for group treatment rooms. We have a muck room for sensory play. So everything that we designed was designed with the help of Lehigh Valley's team to make this the best place it possibly can be for the children that we provide for. And that's the way it is across all of our sites. I mean, we offer adult and pediatric therapy. In the Hazleton area, we are available at the Health and Wellness Center, Station Circle, Mountaintop, and now here at Sherman Court. And we provide adult and pediatric services, PT, OT, and speech across all of our sites. So it's pretty exciting.
And all professional trained people.
Oh, absolutely. We have highly trained people, and they specialize in certain areas. So, I mean, we have therapists that are specialized, obviously, in pediatrics. We have therapists who specialize in neuro, orthopedics, lymphedema, pelvic floor for women's health. We have a wheelchair clinic. The list goes on and on of the specialties, and our therapists graduate from school, but then they specialize and they take extra courses to learn to be able to deliver that specialized care to the populations that need it.
Give me an example of what these things would do in relationship to a child getting rehabilitation.
Sure. So we're in the physical therapy gym. It's actually just the therapy gym. Anybody can use it, but for instance, this swing can be used for motor control, for stabilizing. It can be used for sensory needs for children that need that type of stimulation and movement. The steps are designed for motor control, and you can see the monkey bars and the climbing wall. Everything is designed for strengthening, range of motion, coordination, basically meet any need that a child has.
So in other words, not a child would use all of these, but specific needs, sometimes they come in, it's like a prescription, and so only they would use this or that. But so whatever the need is, you have the item here for them to use.
Correct.
Correct. And that's what's exciting about the place, okay? You have trained people, you have brand new facilities, you have the Angel family that participated in donating. What else why do you think this is such a great place, Catherine? I mean, you really did a great job explaining everything.
It's not only a beautiful place, but we have a fantastic team.
Yeah.
And we have a fantastic team behind us with Lehigh Valley and everything that Lehigh Valley has to offer with Lehigh Valley and Jefferson. So, I mean, it's exciting times.
Yeah.
We're growing. We're continuing to grow. We have, I mean, the team is pretty much what I would say is like the most special thing, because they are just excited about treating kids. They're excited about what they do, and they come in here and they do a great job.
What I really like about Lehigh Valley Hospital is the fact that they're always so pleasant. You know, especially when you're not feeling well, you know, they're there with the bedside manners are great, you know.
Well, that's our goal, to be the partners with the community and to provide that level of care that, you know, people come in and they feel safe and they feel like they're getting the top quality care that they could possibly get and that their loved ones are being taken care of.
Well, Catherine and Ben, keep up the good work, and congratulations to you.
Thank you very much.
Thank you.
Okay, we're going to take a break. We'll be back right after this. Hi, everyone, and welcome to Your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. I'm Sam Lassant. Now, I am here at the new Pediatric Rehabilitation Services in Hazleton that just opened up. Joining me now, we have some therapists. We have Megan Wilkes, Wilkes, right? Who's the doctor of physical therapy, and Georgette Herring, okay? And you are occupational therapist. So, tell me all about yourself.
My name is Megan. I'm a physical therapist. I've been working for about 5 years now. I graduated from Misericordia about 5 years ago and then started working here at Lehigh Valley.
What do you do?
I am a pediatric physical therapist, so I work with kids on their gross motor skills like rolling, sitting, crawling. I work on things like torticollis, so it's like stretching their neck if their head is stuck to a side. As they get older, we'll tend to work on stretching, strengthening muscles, sometimes walking. We do orthopedic injuries too, so sometimes if somebody gets injured with like sport up to a certain age, we'll see them here too. We do concussion therapy for little kids as well.
Okay, so how would I know that my child should come to you?
So there's a couple of different things. Usually you'll get a referral from your doctor. They would see something that they see concerning. Sometimes a parent will also go to the doctor and mention that their child isn't crawling and they feel like they should be, or they're not walking and they feel like they should be. They might notice that their head is kind of tilted, or they're not turning it as much to one side or the other, or they might have had an injury.
Give me an example of a person, a young child, whatever problem they had, and what you did to help that child.
So say there's a child maybe with torticollis, which is their head is tilted and turned to kind of one side. We'll work on stretching their neck so that they can get back to an upright position. We'll have them look at toys, teach their parents how to do all of these things at home so that they're definitely getting the help at home as well. We'll stretch them and then we'll strengthen their neck. We'll move them around to make them work on keeping their head upright and make sure that they can turn to both sides. And then after that, we'll make sure that they're doing all of the motor skills that they should be. So if they're at an age where they should be crawling, we'll look at that and make sure everything looks even. And that's pretty much
What's the time schedule like? Is it a month, 2 months? So when you start seeing a difference, how long does it take?
It varies based on the diagnosis in the child and how adherent to programs that families and parents are. But we typically will schedule kids out for 3 to 6 months depending on the diagnosis.
Megan, what is the most difficult case you've had?
We have some kiddos that are pretty involved. A lot of trach and vent tubes. They'll have G tubes, and we have to kind of like work around those as we're moving them, so they get a little more involved. So I would say that's kind of more of the challenging cases where they're not moving very much, and those things are also impacting their ability to move.
Okay, so as a typical parent, when you have a child that you maybe not doing something, you know, I'm a little, you know, you may talk to your friends or family. I'm a little worried about my, you know, little Sammy's not doing this, and don't worry, they'll grow out of it. You know, they'll grow out of it, and that's what you have, and sometimes they may, but sometimes they may not. Okay, so the idea is, when should you address that, you know, and don't assume he or she is going to grow out of that, okay? What would be your advice to that parent?
A lot of times when you go to the doctor and you talk to them, they have ranges of ages that they will accept things as normal until. And then once it hits a certain age, they'll say, you know, now I want you to go see a physical therapist. Sometimes they'll also just send you to physical therapy. We'll come in, we'll do the evaluation, and then we kind of use outcome measures and things to determine if they actually need the service or not. And if they don't, then they don't have to keep coming back. Or if they do, we would schedule them out for therapy.
Now, Georgette Herring, okay, you're an occupational therapist, okay? So what's the difference between an occupational therapist and a doctor of physical therapy?
So what I look at is more functional play. So I take in like how they're using their hands, how they're playing with toys. Are they looking, truly are they looking or attending to things? So that's another thing that I'll look at as well. So we look at, I kind of say like PT works on more lower body, but then we work on more upper body. So like using their hands, how they play, things like that.
And here again, how do I know if my child should come to Georgette at the rehabilitation center?
Sure, yeah, usually if they're not meeting, most typically if they're not meeting like the crawling, the walking at those, at the lower stages, the younger stages, usually that would probably present to like, let's go to the doctor and see, and voice our concern to the doctor.
So walk me through a case without mentioning a person's name. How they came in here and what they had and what you did for them.
Sure. What we do is we look at, taking, say, a consideration of a diagnosis with autism. A lot of times the kiddo isn't able to able to attend, isn't able to play with certain toys. So we'll try to make them attend at the table. So we'll sit and try an activity at the table. We look also at coloring. So if they're doing, coloring and writing as they progress to the school age, to 5, 6, we want to make sure they're doing those things too. So we'll sit at the table, we'll do activities, but then we'll also give them breaks. Some of those kiddos also need sensory breaks. They can't always sit for a certain amount of time, so we'll try to get them up jumping, maybe going on a big ball, just to get them out of, to get their attention back.
So when I'm sending my child to rehabilitation, okay, of course I'm concerned, okay? So, but what I want to make sure is that to get a brand new rehab center here, I want to know that person, Georgette, what qualifications you have. You can maybe be the nicest person in the world, but are you qualified to take care of my kids? Starting with you, could I feel comfortable in making sure that Megan and Georgette will take care of my kid? Megan, you could answer that question.
Yeah, so as a physical therapist, you go through 6.5 years of school. You have to take a board exam that certifies that you have the knowledge. Georgette and I have both worked in pediatrics. She's been here longer than I have in pediatrics, but I've been working with pediatric patients for 5 years. We've had a lot of patients and their families very grateful for services that come in, and the kids are excited to come in. So a lot of times that'll tell you things too. You open the door and they're ready to come in, and then they don't want to leave. So
that's right.
That usually is a good indicator for parents.
In your case?
So I went for schooling for 5 years. So I have a master's degree in occupational therapy. I sat for my state board, so that we do that every so many years. We have to keep updated. I've been here 15 years. Like Megan said, I've been here a little bit longer, but working with kids pretty much for the years that I've been here. But it's the kids when they smile when they look at you and they're happy to be here. It's a good feeling.
Well, interesting, the both of you are happy people, you have to have patience and you have to have that passion. Okay, and because, the parent or the guardian's nervous the way it is, and is my kid going to be okay? And, you have to walk them through that. Are there times when you may detect something that the parent is not aware of, that you may have to either tell her to see a doctor or whatever? So because you're seeing that child in a whole different perspective than the parent is.
Yeah, so sometimes if we see something that's kind of out of the ordinary, we'll talk to the parent about it first, gather information to see if they're seeing that at home, and then we'll usually ask them to see a doctor, see their primary doctor. We can call the primary doctor sometimes to discuss it. Usually we don't necessarily diagnose anything, but we might say, like, we're seeing this isn't really typical, so we want you to go see your doctor so they can determine if there's more testing that needs to be done.
And because of the experience, you'll be able to do the same cases.
Correct. And sometimes if they come for me and the parents say, oh, I'm not seeing them walking, they're not crawling the right way, or they're not doing something that maybe that's more Megan's job, that's when we'll talk to them again. Oh, okay, maybe you need to go see the doctor, and then we can get a physical therapy script as well. Well,
you have a passion for this, don't you?
Yes, we do love it.
You have to.
Yes.
You really have to. Well, I wish you the best. It's a great location.
Thank you. Yes, it is.
Yes, it is, and we're busy, so it's good. Yes. We stay busy.
So you're watching Your Health Partner, brought by Lehigh Valley Hospital, Hazleton. The address is on the screen. If you need them, they're here for you. As you just heard, they're well qualified. We'll see you next time.